So Michelle Scala was down in South Carolina when she was in a horseback riding accident. And from the accident, she sustained a traumatic brain injury, and she also had pelvic fractures. So once she was stabilized medically down in South Carolina, she was brought up here to Adventist Rehabilitation Hospital for her rehabilitation needs.
We heard about Adventist Rehabilitation Hospital from two different sources. One from the caseworker at Richland Palmetto Trauma 1 had determined that this was one of the better location choices for us, and also from a physician it also took Shelley's case for her pelvic recovery, pelvic injuries up here. I thought it was a very calm and serene place, and it put me at ease, and it was very friendly, and the people were obviously caring and seemed very coordinated in how they got Michelle comfortable and into her room and in for her first meal that evening after an 8.5-hour ambulance trip from South Carolina.
When I first evaluated Michelle, she was confused, she was disoriented, she was very restless, she was in a lot of pain, and functionally she needed maximum assistance just to get out of bed. So she was followed by our acquired brain injury team at Adventist Rehabilitation Hospital. And that consists of myself as the physical medicine and rehabilitation physician. It also includes her nurse, her physical therapist, her occupational therapist, her speech therapist, the neuropsychologist, and the social worker.
We did a behavior plan for Michelle, basically to help her brain heal. And there are two major components. One is the quiet environment that allows her brain to take in the information it needs but not to become overstimulated. And the other part of that is also keeping her very safe. So the first thing we did was we started a behavior management plan. Not that her behavior was all that disruptive, but we just really wanted to keep her safe and allow that brain to heal. For her, she had a little bit of awareness that things weren't right. And that made it much more difficult on her emotionally because she would sometimes become tearful. She was working very hard to figure out what was going on around her. And as soon as her brain allowed her some more information, she really did click into the rehab program. She was quite active. She was very involved. Everybody really liked working with her.
As in outpatient therapy, when she started, she worked on deductive reasoning, high-level cognitive types of tasks, but was considered at a severe level. She was having trouble with her memory. She was having trouble with her insight. Another thing, we might give her a worksheet that had several tasks. What are you going to do first? What are you going to do second? And she has to keep all those things in mind. One, that all of the tasks she has to do, but also in a time frame, what would make sense.
I think family is absolutely crucial. And Michelle's family, they were great. They were asking the appropriate questions. They were very involved. They were trying to find out what to do and how to help her. And they were very caring. It was obvious that they were very caring. You want the family as part of the team. You want them to be just as updated as another staff member coming in so that they know the changes that the patient's going through day by day. And they also know that their loved one is getting the attention that they need.
The staff spent lots of time with me explaining to me what I should be looking for, what I should be concerned about, how I could help Michelle along with her continued recovery. I found the time they spent with me very useful, and they were extremely patient in answering any questions either Michelle or I had.
She was so motivated to do everything by herself. You know, she did something that she wasn't supposed to do that was unsafe. You know, her husband would be right there talking to her and, you know, reinforcing our safety just as we do. We reinforce safety issues to her every day, every time we see her, to make sure the call bell is right by her, ask for help when you need it.
And she was slightly impulsive, wanting to do things on her own and not remembering her safety precautions. So we had to really educate her on being safe and independent and asking for assistance initially. So it was very good for her to work with her husband to figure out how to ask for assistance, how to allow her husband to help her, how to allow her husband to give her suggestions and to be safe while she's doing it and not to get so overwhelmed with everything she has to do. Her and her family were very keen to the little steps that they had to take, and they appreciated the little small steps. Whenever she would improve or have a success, she would always come up and share that with us with a big smile, and she would always give me a big hug. So she was very happy on all the achievements that she made in inpatient and in outpatient.
The patients that we needed to every day look for the improvement and Shelley's recovery, that was a real challenge. When you'd stop and look back over the past few days or a week, you could realize the recovery, but the day-by-day challenge of wanting her to get better quicker was something I think that was probably the most challenging event for me.
I think as she saw that there was a certain point where she started having significant progress in therapy, and she was very happy with that. And then towards just discharge, my job is to make sure that she has everything that she needs, that there's a safe plan for her. With Michelle, when we discharge her with 24-hour supervision, instruction to the family. So at the time, because she was having some cognitive issues, we didn't want her being by herself. So just making sure with the family that there is a plan of coverage and how they were going to handle that.
She stayed about 3 weeks, and at the end of that time, she had made really remarkable progress. Cognitively, she was much better. Her pain was well controlled, and functionally, she was able to walk at a supervision level. And when I saw her back in follow-up at about a month, she had continued to progress beautifully, and she was essentially back to her old self.
Last Saturday, Michelle was playing football with our son Travis and threw a pass to him and then decided she would chase after him and try to tag him, and she chased him for about 60 yards. That was the first time I've seen her run since March 28th.